Hi, my name is Dr. Jamie Fleming. I am a pediatric anesthesiologist and interventional pain specialist at Phoenix Children's Hospital. I'm currently the section chief for the pain section, and I'm double board certified in both pain and anesthesia. One of the things that's really important to know is these misconceptions not only influence the experience of the patient, as we talked about before, but also can affect the level of disability that the patient ultimately reaches when they are not recognized promptly and treated promptly. And that brings me to the first and big misconception, which is pediatric pain is rare. And that's actually not true. It's very common. And when you look at the numbers, really 1 in 5 pediatric patients actually has chronic pain. So this is something that everyone's going to see in their clinic, and is really important to recognize that it is so common. The thing that is important for treating it early is that it can persist in adulthood and cause disability that's long lasting for these kids. What I've seen a lot in medicine is it's really under recognized and underserved. So what that means is when these kids are out there, oftentimes it's taking a really long time to recognize that they have chronic pain that needs treatment. And even if you do, there's not often local resources to really treat it effectively. So here we're fortunate at Phoenix Children's because we have a comprehensive pain program, and we're the only one in Arizona. But there's a lot of medical facilities that really don't have access to these resources. I think some of the other misconceptions are best highlighted with an example. And I think a lot of us have seen this, but we've certainly seen it many times in our pain clinic. But for example, a teenager or an adolescent that comes in with persistent pain after a minor injury, something like a minor ankle sprain or things like that, where they've had all kinds of imaging, labs, and a workup, which really doesn't show any ongoing injury. And despite this, they're still not walking, they're not returning to sports, they're sometimes missing school, and it's really impacting their life. I think when this happens, sometimes these patients have heard things like, oh, there's nothing on these studies, so there's nothing wrong. And, this may be all in your head. And it's really important to not give patients that message because it really invalidates them. And when we see them in clinic, we have to kind of explain why this happens and what the whole nervous system process is. And really, pain is your nervous system processing signals and giving you a response. And it's there to try to protect you, but sometimes it gets it wrong and it still keeps sending these signals even when the injury itself is healed. So that's a really important message to convey. And along those same lines, the amount of pain that you have does not equate to tissue damage. And so that's important when we're trying to explain the therapies that patients will need to treat their pain. Just because there's pain signals doesn't always mean that you're damaging or injuring something, and that's a really important aspect of their care. Going along with that too is when we explain our treatment plans, which the foundation really is physical therapy or occupational therapy and pain psychology, there's a lot of misconceptions around that. Pain psychology does not mean it's all in your head. And in fact, what they really do is they help children really understand this nervous system process and learn how to control it better. They address a lot of underlying stressors in the background, and really both physical therapy and pain psychology teach children to regain confidence in the body, to gain control over their nervous system, to help retrain these processes. I think when you're looking at what should prompt a referral for a pediatrician, you really have to look at how is this pain impacting that child's life. If it's impacting it and they're changing their routines and avoiding things because of it, it's time to get help and it's time to refer.